So good morning, ladies and gentlemen. My name is Chris D'Agostino, and I'm really excited to welcome you guys to my SYP presentation. Now, what I've been doing for the last 2, 3, 4 months is I've been sort of constructing my own arguments and sort of bringing together arguments about how theater can help improve symptoms of autistic spectrum disorders. Now, I just want to tell you a little bit of how this applies to me before I sort of go into my arguments. So I've been diagnosed with 2 autistic spectrum disorders throughout my life. There's Asperger's syndrome and there's PDD-NOS. I don't know which one I have, but I do know that a lot of things that the people with ASDs struggle with, I struggle with as well. Now, before I get into my arguments, I just want to establish 2 things. One is I just want to get across the idea that when I'm talking about, ASDs and the things that they struggle with, I'm speaking in generalizations. I don't want you to get the idea that everyone with an ASD struggles with social skills tremendously, because they don't. So that's what I want to get across first. And the second thing is I just sort of want to establish what is an autistic spectrum disorder, because as we speak, the definition of an autistic spectrum disorder is changing. Okay, what defines an autistic spectrum disorder? I'm going to read this to you and then I'm going to explain it. It's impairment in reciprocal social interactions, communication which can be verbal, nonverbal, or both, and a repertoire of restrictive or repetitive behaviors. Now, I'm just going to, for the purpose of this project, the purpose of this presentation, I'm just going to lump together social interactions and communications. So, impairment in verbal communication. So, some people with autistic spectrum disorders have limited vocabularies. Some of them can't speak. Nonverbal communication difficulties. Okay, I'm going to give 2 scenarios to sort of illustrate this. I'm talking to my friend Jimmy here, and I'm talking, so I have an autistic spectrum disorder, and I'm talking to Jimmy, I'm talking, and he's trying to communicate to me through his body that he doesn't really want to talk to me. He sort of has his head in the other direction, he's not making eye contact with me, he's kind of moving his body around, and he doesn't want to say, "Chris, stop talking," because it's rude, so he tries to communicate this through the subtleties in his body language. But what I have a problem with is I have a problem with picking these cues up. And on the other hand, I have problems with presenting myself in a non-verbal appropriate way. So let's say I'm in a heated argument with Jimmy. We're sitting down and I'm kind of in a laid-back position. And we're in a heated argument and Jimmy doesn't really think that I'm taking him seriously, even though I think I am, but I don't know the significance of my slouched back position. I don't really know how that's affecting him. So there's that aspect of sort of how you present yourself non-verbally. Okay. A repertoire of restrictive or repetitive behavior. I would like to include thought into this sort of equation. Restrictive or repetitive thought. Now, I'll give you 2 examples of mine. Restrictive or repetitive thought. Every time I go to Great Harvest, I order a grilled cheese panini with garlic spread and bacon. Every time. So this sort of aspect has to do with routine. It's repetitive sort of ways of going about your life. I know what I'm going to get when I order it. I like it, and I'm sort of not really I don't really like the idea of going outside of my comfort zone. And repetitive behavior. So when I was 4 or 5 years old, I would do this. And I would like to argue that these 2 ideas, restrictive repetitive thought, restrictive repetitive behavior, they all sort of happen because people with ASDs sort of rely on sameness. So like from my Great Harvest example, there's sort of the sameness aspect of going there, and every time I go there, order a grilled cheese panini. And also with the physical aspect, there is this idea that I control my environment. There's something about my environment that I control. I do this while the world around me is changing. I still have the capability to do this, and something about the world is saying the same. Okay, types of ASDs. This is what's likely going to show up in the DSM-5, which will be coming out at the end of this month. There are 3 types. There's classical autism, which is typically the most severe form of autism. People with classical autism, some of them have limited vocabulary, some of them have no vocabulary at all. some of them don't speak. And then there's Asperger's syndrome. And this is characterized not by verbal difficulties. Many people with Asperger's have good sized vocabularies, but the non-verbal difficulties I was talking about earlier with my Jimmy examples. And then PDD-NOS, which stands for Pervasive Developmental Disorder Not Otherwise Specified, are people who really don't fit into the other ASDs, but they still qualify for an ASD. So here's my first argument as to how theater can really help the symptoms of autism. So self-awareness. In theater, there's this aspect of intention, what you want and how you're going to get it. So let's say I'm doing a scene with Jimmy, I'm playing a character, he's playing a character, I want all of Jimmy's money. It probably won't be written in the script that I tell him, Jimmy, I want all your money. I have to portray that in other ways, probably through my nonverbal communication. Like I may sort of act intimidating at first. I may sort of portray that through my body language that I want his money, and it might scare him into giving me his money. Or maybe I see that doesn't work. I may look at his nonverbal sort of cues and he may not buy it, and so I may try something else. I may try sort of being the nice guy. So here's this aspect of presenting yourself nonverbally and sort of reading nonverbal cues that are in theater. So I just want to get across this one idea, which is, so I was doing a lot of interviews, and there's this one drama specialist who sort of focuses on helping people, particularly people with Asperger's, cope with their symptoms. And she kind of parallels this idea to everyday life. So she sets up a scenario. It's she has a bag of potato chips in front of the person with an ASD. And she says, I want you to show me, her name's Elise Wolf, by the way. I want you to show me a way that you can grab the potato chips and that I won't find it rude. So maybe the first time they just grab the potato chips, and she may say, okay, that's a really rude way of grabbing potato chips. Try something else. She may, so then they may have a different way of approaching it. He may have his hand on the potato chips and say, oh, can I have these potato chips? And then sort of take them nicely. And then there's this idea of the social fake. Something that I've learned from acting is that you can't be honest 100% of the time. That would be torture. Like, I can't portray happiness all the time. I can't portray sadness, so sometimes I have to fake. Obviously, the best thing to happen is if it comes from a real place, but you have to be fake sometimes as well. Now, this really sort of translates to social situations because let's say you're at your grandmother's house and she gives you chicken in front of you. You eat the chicken, you hate the chicken. You don't want to tell her that you don't like the chicken because it hurts her feelings. So you kind of, I don't want to say lie, but you fake liking the chicken. Okay. So then there's this aspect, good physical presentation encourages self-confidence. So this is something that I actually learned recently from a TED Talk. And it's very similar to an experiment with Paul, I think his name's Paul Ekman. We learned it in psychology, that if you put a pencil in your mouth to force you to smile, it actually encourages you to be happy. So there's a sort of aspect of mind sort of your body influencing your mind. And the same thing goes to theater. Like, let's say I'm portraying Henry V in Shakespeare, and I sort of have to have a demanding presence about me. I have to portray a leader with my body language. What that does is that increases testosterone level, and it lowers cortisol levels, which has to do with stress. So it actually sort of makes me more of a leader if I present myself that way physically. So then there's this aspect of emotional intelligence, how theater can help with emotional intelligence. First of all, what is emotional intelligence? The awareness of one's own emotions and moods and those with others, according to the World English Dictionary. So I kind of interpret it as, okay, so sort of labeling emotions, the ability to step back from your emotions and sort of say, okay, I'm feeling sad, I'm feeling angry, what do I need to do about this? Or sort of labeling someone else's emotions. He's feeling sad, he's feeling angry. So there's this aspect of imitation / so what drama sort of encourages you to do is sort of interpret another person's actions it kind of helps you with developing a character. I don't want to say imitation because Unless if you're portraying like Gandhi or someone like that. You're not sort of like looking at someone and incorporating every aspect of that person. Like if I'm developing a character, I may sort of consciously or subconsciously sort of take other people from my environment and sort of incorporate them into my character. So now let me show you something. This is your brain on imitation. Now before you get too scared by this, I'm just going to read something in this book. It's called Social Skills, Emotional Growth, and Drama Therapy. Very good book. And it says, in the anterior insula section of the brain, visual information concerning the emotions of others is directly mapped as a result of imitation onto the same motor neural structures that determine the experience of that emotion in the observer. Okay, let me illustrate this. Let's say I'm imitating someone. For the purposes of this, I will be imitating Mr. Brown. He's not here. Okay, so Mr. Brown, he's the guy who kind of gets up before, he goes up before every show and he goes, "Good evening, ladies and gentlemen, my name's Adam Brown," and yada, yada, yada. So what happened right there, Mr. Brown is mapped onto my anterior insular cortex, and I actually, because it's mapped onto the same structures that determine my emotions, I actually sort of feel what Mr. Brown is feeling at that time. And this sort of establishes empathy with him. I can kind of, because Mr. Brown sort of became a part of me, I can empathize with Mr. Brown. And also, I'd like to take this sort of a step further with my sort of theory. So next time I'm at a cocktail party, I can kind of incorporate aspects of Mr. Brown into my presentation. I may be sort of funny or this or that. So Mr. Brown sort of became a part of me. Okay. Emotional intelligence continued. So the exercises I was talking about earlier, they usually have to do with more people who have Asperger's syndrome. Now you may wonder, okay, so what are exercises that you can do with autistic children? Because the difference between autistic children and children with Asperger's syndrome is that autistic children, they don't really have the understanding of language. So if you put a script in front of someone with autism, they may not be able to understand it. So there's this aspect, again, Elise Wolf told me one interesting sort of exercise that she does, and it's sort of facial imitation. So she may, do a happy face or a mean face, and she asks them to imitate that face. And what this does is, because they're imitating, it sort of establishes empathy. And there's just one more aspect, it's not part of the diagnosis of autistic spectrum disorder, but people with autistic spectrum disorders are usually prone to anxiety. Now, I just want you to think about that for a second. Okay, so you're diagnosed with a social disability, and you have a social disability. Chances are, if you are in a social situation, you might get a little bit nervous because you really don't want to screw up. So this is where sort of a lot of the anxiety comes from. And I just want to mention this one genius example in this book about how this one drama game sort of helps people with ASD cope with anxiety. So, this author has a group of kids with ASDs in a room, and this game is called the director's chair. So someone with an ASD sits in the director's chair, and the person sort of comes up with a scenario that bothered them. Maybe they threw a temper tantrum because they didn't get what they wanted, or they're very angry with their mother or something like that. So what this person does in the director's chair is he casts his play among the group of people with autistic spectrum disorders, and so he casts himself. So he's directing a play, and he's directing the person who plays himself. So what the director does is, so they role play the scenario. They go about the scenario, and the director says to the person portraying him, "I want you to act sad. I want you to act mad." And what this does is, because the director can now sort of verbalize emotion, she can step back and say, okay, I was feeling sad, I was feeling angry. You can kind of incorporate, the verbal aspect. So it's more like the rational side of your brain helps you cope with the anxiety part of your brain. This doesn't really have to do with like traditional theater, but I just thought it was interesting and I just wanted to share it with you guys. So then there's this idea of trying something new and how that helps ASDs. So there's this idea of, okay, if theater, traditional theater really helps children with ASDs, then improv is extremely useful in helping children with ASDs. So there is this one part of the diagnosis that I was talking about earlier, which is restrictive behaviors and restrictive thoughts. I brought up the Great Harvest example, and I brought up this example. So I'd like to argue that those things happen because there's a distance between your action and your thought. Like, let's think about the Great Harvest example. Because I know what exactly I'm going to get at Great Harvest every time, I sort of think beforehand and I act on it later. I sort of know exactly what's going to happen. There's not like I go to Great Harvest and I say, okay, today I want a roast beef panini. I don't unify sort of thought and action. And the same thing goes with this, because when I do this, I'm just doing. I'm not really sort of consciously thinking about how these actions could sort of help me or sort of are productive. So what improv does is it unifies thought and it unifies action, because in improv, so I'm going to give you another situation. So my friend Jimmy is in front of me and he brings up a scenario. So we're part of an improv game and he says to me, Chris, I want a refund on all these tomatoes. Me having the autistic spectrum disorder, I don't have any time to sort of think before I act. I have to think while I'm acting, because that's improv. You have to think on the spot. You have to sort of be in the moment of things. And hopefully this kind of way of thinking, which is unifying thought, unifying action, hopefully it will sort of, the person with the ASD will say, oh, it's actually okay to sort of be in the moment, to sort of think in the moment of things, and not sort of to plan everything beforehand, not sort of to sort of plan conversations before they happen, or just sort of they be in the moment. So it could help kids sort of find comfort from discomfort, and it could help sort of them grow confidence in this new sort of style of thinking. And also, there's this aspect of improv, which is you always have to say yes to the person who you're talking to. So I'll give you the example I just used. Okay, so he comes to me, he says, I want a refund on this tomato. I can't say no, because that's not really improv. That kind of slows down the sort of train of thought. I have to say yes in order to sort of have the improv game moving forward. And by saying yes, I'm acknowledging what he is saying. So there's this reciprocal aspect that was lacking beforehand. Okay, so this is just my last argument. This is incorporating symbolism into thought. This kind of sort of relates to what I was talking about before, but people with ASDs often think in a black and white manner. So I'm going to sort of just give one example. Let's say I say, consider this phrase. James was blind. James is blind, but he can see. If you tell this one to someone with an ASD, that may confuse the crap out of him, because there are two sides of the pole. Okay, so there's one side of the literal pole, which is James can be blind, and there's another side of the pole, which is James cannot be blind. And in between is symbolism. Like, let me illustrate this. Okay, so consider the phrase again. James is blind, but he can still see. Maybe the second part, he can still see. Maybe that doesn't have to literally do with seeing. Maybe that has to do with perceiving. Maybe that has to do with feeling something else. Maybe it's not literal. And so I feel as though theater, symbolism is everywhere in theater. First of all, you're portraying a character who doesn't exist. Your friend is portraying a character who doesn't exist. And so much sort of imagination is required. You're imagining things that may not be there, especially when you're doing a monologue. If you're doing a monologue, you're imagining a scenario that's not there, and it sort of helps with this whole symbolism aspect. And then there's a literature aspect of theater. And I feel as though, in typical literature, things aren't always taken literally. You know, obviously there's sarcasm in some places in a play. There's you know, ulterior motives, and there's this. And I feel as though if people with ASDs, well, particularly Asperger's syndrome, can sort of read and understand this, that will really help them with sort of understanding the whole symbolism aspect. Okay. So here's a rebuttal that you may have to me. Okay, so I sort of believe that theater helps social skills. But if it does, why don't all actors have great social skills? And this is something that I was thinking about. This is what my interviewee said, Elise Wolf again. She said, okay, so there are different types of approaching acting. There may be sort of a type that emphasizes your own character and not really the reciprocal aspect of theater. What she does in this book when she's sort of teaching drama therapy class, well, you can argue whether it's called drama therapy or not, but what she does is she sort of emphasizes more this reciprocal aspect of acting. And you know, maybe some methods emphasize more of the character aspect of becoming one character, and it focuses more on yourself. Now here's my theory. This is from just my experience as an actor. Acting, especially sort of being, well, for me, as someone with an ASD, acting or being in social scenarios, it takes a lot of work. It doesn't come naturally to me as it comes for a neurotypical person. So if I'm being, you know, charming and exuberant and this and that, it takes a lot of energy. It's not sort of a walk in the park as it may be for some of you people. Rebuttal number 2 that you may have. If theater is so great for treating autism, why isn't it taken seriously among psychologists? Now this is one interviewee's theory, and this can be argued. Science and art have a very awkward relationship because the way science goes about things is that you quantify changes. So let's say you're doing a science experiment measuring the amount of sodium before and after a chemical reaction. So there's 1 G of sodium before and then there's 2 G after. There's this plus G difference in what's happening. So how do you measure social skills? How do you measure artistic progress? Do you say my social skills went up 0.5 points? How do you measure that? So there's that aspect. And there's also the aspect of the methods to evaluating theater may be too subjective. So let's say I'm participating in a sort of theater program which helps me deal with my ASDs, and I'm given afterwards sort of an evaluation sheet. I'm asked, okay, so how do I feel as though my progress has improved in these last few months? I may sort of evaluate my progress, but maybe my theater teacher thinks differently. Maybe my mom thinks differently. Maybe my dad thinks differently. So there's this subjective aspect. And what's interesting is I talked to my other interviewer who was a neuroscientist. She says these objective measures, they do exist. She says in her program, she incorporates, first of all, she makes it very rigorous, so she sort of sees change in her students. And before and after, there are, you know, she uses fMRIs to scan brain activity, how different their brain was before and after. So there are objective measures, but here's what I think. Not everyone has an fMRI in their backyard or whatever. So there's that aspect. Okay, so here's my conclusion. So from my research, I've sort of discovered that it's almost as if theater is made for autism because it so conveniently strengthens the problems that are associated with autism, which are self-awareness, emotional intelligence, a black and white way of thinking. And I just want to sort of get to one takeaway message from this project. I don't want you guys to get the idea that autism is all bad. You know, if autism never existed or the autistic spectrum never existed, our world would be a very different place. We probably wouldn't have Albert Einstein. We probably wouldn't have Isaac Newton. So in a way, these rigid ways of thinking among these people help tremendously sort of improve the world which we live in today. So maybe It's funny, I was talking to someone after my informal presentation, and he posed this question to me. He said, okay, so let's say there's this child prodigy, and he has Asperger's syndrome, and he is very interested in biology, and he wants to be put in sort of a theater group. But the thing is, won't that theater group sort of allow him allow him sort of to, in a way, it's overcoming rigid ways of thinking, but if he doesn't have that rigid sort of interest or rigid sort of thoughts, how is he supposed to sort of really get into biology? So there's that aspect, which is sort of thought-provoking for me. So I guess maybe you should think about, what are they interested in? Are they interested, to get them involved in drama therapy? Are they interested in biology? And if they sort of go by these rigid interests, will they become the next biology prodigy? Or are they interested in the way that Jedis calibrate their lightsabers? So it's like, there are these rigid interests, are they useful, are they not useful? But what I think theater does, in conclusion, is it really incorporates a new perspective into the way that people with ASDs think. Thank you.
Questions?
Yeah.
So it's clear that you've done a ton of reading and interviewing with people about
Yeah.
their and autism, how that works.
Mm-hmm.
And you say that, and I love how you kind of, you conclude very specifically. Where do you see drawbacks to this kind of theater and autism spectrum? Like, is there a limit to this? Where, you seem to be someone who's really benefited from this experience, but where do you see people who might also be on the spectrum really kind of struggling with areas where you've succeeded?
I'm sorry, can you just explain the limitations part? So
when you say like you've grown an immense amount in this experience, it sounds like. So
yeah.
Would someone who has who has more limits in terms of their
is sort of like, yeah.
Where would theater maybe not be able to reach them, or did you look at that, or did you?
Yeah, I looked at, I was talking about, there are people with autism, with classical autism, who sort of, they don't have the verbal abilities, and, if you put a script in front of them, they may not be able to understand, what's going on, and sort of, so there's that aspect. There are limitations for people with classical autism because they don't understand the literature aspect, and they can't really benefit from the literature aspect. But what they can benefit is from sort of, recognizing faces and sort of the empathy aspect. So that's what I think. Any other questions? Yeah.
Have you ever thought of, I know you said psychology and art do not mix together.
Yeah.
Do you ever think that this could be a good psychotherapy exercise?
Psychotherapy exercise. What do you have in mind?
I don't know, I've taken psychology in college and I learned about all the basics.
Yeah.
And there's plenty of styles to psychotherapy to help certain, diagnose certain mood behaviors, things like that.
So are you talking
about there could be a psychotherapy for this?
Sort of,
Autism and
well, you're talking about sort of the diagnosing. Are you talking about diagnosing people with? Are you talking about using theater to help diagnose autistic? That's it. I've never thought of that before. That's actually really interesting. Since I haven't thought about it, I don't really have much to comment on, but I don't see any reason why it really wouldn't help.
Well, if you think it helps, then you could probably, spread the information out.
Yeah.
Let them know,
Thank you.
Actually, based off of that, I've been trying to think of a question that I've been thinking about the notion of the self.
Yeah.
You've been talking this whole time.
Yeah.
And I've been trying to figure out whether you're talking about this as a therapy to assuage symptoms, or is this also a way to further know the self of the person targeted? And is basically does theater kind of give a full body mind experience on how to understand the idea of metaphor and self-knowledge?
There's this one part. Sorry, can you repeat the last part of the question?
I think the last part was, does this therapy kind of give a full body and mind experience towards the be a process of self-knowledge.
Yes, and something I didn't bring up before was the idea of mirror neurons, and something in this book that actually sort of, mirror neurons are sort of neurons that happen like, if I see someone and I'm imitating them, then my neurons sort of have sort of the same, they sort of imitate what that person's doing, and it says in here that it's actually interesting that you say full body experience, because through imitation, through sort of, incorporating my body, that and sort of imitating or incorporating other people's perspectives, that really sort of allows you to understand your body and sort of what you can do with your body and your mind, if that answers your question. Yeah.
I was just wondering if, based on your experience, do you think that people that have a spectrum disorder are more drawn to theater, or was it just sort of a coincidence, like with you, that you got into theater and realized this connection?
That's interesting, because I kind of I started when I was 5, and it was just because my friend was doing it. I didn't really think theater's cool. But it's funny, as I was reading some of the examples in this book, a lot of them are sort of scared of doing theater because, as I said before, anxiety and stepping out of one's comfort zone is often associated with ASDs. And so if I'm put into sort of, a theater setting and I'm 4 or 5 years old, that may sort of make me anxious. Now, I think it's up for the teacher to really calm the person's nerves and sort of, relate to the student, and that's very important. Yeah.
So it sounds like Elise Wolf wrote that book.
No. She's a local therapist who I interviewed. This is just a really awesome book.
All right. So who else did you talk to besides Elise Wolf?
Oh yeah, I talked to a neuroscientist halfway across the country. Her name's Dr. Blythe Corbett. She teaches at Vanderbilt University, and she has this program called Sense Theater, in which she sort of incorporates the sort of specific drama exercises that I was talking about, and she has fancy science equipment to sort of evaluate before and after, and she kind of uses that too, because she has skeptical colleagues. That's what she told me. She said, a lot of my colleagues are not really, they don't really believe what I'm saying, and by using this sort of fancy science equipment, objective measures, I can really get at the change before and after. So that's sort of a difference between her and Elise Wolf, because Elise Wolf, she said she was sort of more skeptical about how you measure change and progress. So.
Good time for one more question.
Oh, hi.
So what pops into my mind almost immediately with this is behavioral therapy.
Yeah.
And I was wondering, if you kind of look at that. When I look at behavioral therapy, I
Sure.
think of students I've worked with in the past who have
Yeah.
had aides and therapists with them a lot during the day.
Yeah.
And they're kind of, the purpose being, kind of identifying those places, a lot like what you're describing with the drama therapy about,
Yeah.
oh, did you notice that you did this, and kind of modifying behavior.
Yeah.
Did you kind of look at kind of like how that could work with behavioral therapy at all?
Behavioral therapy. Do you mean you're talking about behavioral therapy in sort of not even autistic spectrum disorders and sort of more like a general aspect?
To be particular,
Yeah.
I am referring to it in terms of
Okay.
kind of the classical autism
Yeah.
idea, because that's what I've had the most experience with behavioral therapists.
Yeah.
And I don't know, I'm trying to articulate this question better. I'm thinking back to the idea that was brought up of the self a little bit too. So
Yeah.
how does this cross with, in my mind, I'm trying to cross, okay, you have drama therapy,
Yeah.
and that seems like a concentrated
Yeah.
version of behavioral therapy.
So how do you unify?
How do you merge them, or how would they be different? I guess, is one of the things that comes to mind is because behavioral therapy gets a lot of play in terms of academia and
Yeah.
scientific
Sure, yeah.
response. How are they different, and why can't they actually be viewed very similar.
And that's actually interesting that you say that, because the neuroscience that I was talking to, she doesn't say drama therapy. She just says there's behavioral therapy and there's sort of theater, and she sort of merges them together. And sort of the aspects of behavioral therapy, such as reinforcing someone or sort of extinction, getting rid of some sort of different types of behavior. She sort of merges this with what drama therapy is. I don't know if that answers your question.
No, yeah, exactly. I just was wondering if someone had talked about that connection or written about it. Because that's immediately what came up in my mind. That the things that you're describing.
Yeah.
Are a lot of the things that have been behavioral.
Yeah, it's very, and it just turns out actually that behavioral therapy is sort of, and I said it kind of is sort of intertwined with drama therapy. Behavioral therapy is a lot more useful than, I read about sort of, types of medications. If you don't have protein or lactose or something like that, then, the symptoms will go away, but that's a load of crap for the most part. And behavioral therapy and sort of the doing aspect really gets at sort of, overcoming a lot of the symptoms.
That's all the time we have.
Mm-hmm.
Thanks, Chris.
Yeah.